Have you ever had an Achilles problem that just won't go away? You've tried rest, you've tried some treatment, tried some insoles, and it just won't shift. Today, I'm going to talk to you about the 5 reasons why Achilles problems can stick around. My name is Ed. I run a physio practice in Tooting, which is in southwest London. We specialize in treating Achilles problems. Let's get started. The first reason why sometimes people don't get better from an Achilles problem can be due to a metabolic issue. For example, if someone has low estrogen, for example, women who are going through menopause, that can lead to the tendon not being able to recover as fast after exercise. They're more likely to get a tendon problem, and also it's more likely to persist and maybe not respond to treatment as quickly. So there's a lady who came in recently with the same problem. She actually started HRT halfway through the treatment, which she was still making progress. It was just taking longer than normal, but she actually got better a little bit faster once she'd started HRT, because that helped to reduce and improve the ability for that tendon to remodel. That's one example. Second example of why someone can have an Achilles problem that just sticks around and doesn't get better is they rely on rest too much. Now, for example, there was someone who came into the clinic, it was at the start of this year, said, I've been resting for 2 years and every time I go back to running, it just comes back. I've tried all these different shoes, I've tried these different stretches, I've mostly used rest and it's not got better. Now, the reason why that is because tendons respond to load. So they're a little bit like a muscle. So if we strengthen a muscle, the muscle gets bigger and can tolerate more and can lift more. Tendon is the same, basically. A tendon starts to do nothing because it's resting, and just like a muscle will get weaker and smaller, and you see people who have been in hospital for a period of time, or maybe they've been in space. Obviously, their muscles atrophy, so they get really weak because they're not using those muscles. The tendon will do the same thing. So it will feel better because the tendon doesn't hurt as much because it's not being tested. As soon as you go back to trying something like running, it's not ready for something like running because it hasn't done the work to get up to that level. So over relying on rest isn't a good strategy. Someone who came in about 3 weeks ago with the same thing, our tendon was so angry we couldn't do anything with it for about a week. We'll be using ice and soft tissue work, taping, various other things, calm the symptoms down. And then after that week, we started to load it and do some work in the gym, our rehabilitation gym that we've got. And then she was able to start building back up again. So we only used it for a week in that situation, just as an example. Number 3 is not having a progressive rehabilitation program. Now, I'm going to explain what that means. There was someone who came in recently who'd come in for a second opinion. Now, sometimes people come to see us because then they haven't got better. The physios that they have been seeing had been doing the kind of ballpark right things. But what they weren't doing is progressively making the rehabilitation more and more challenging. So the tendon has stopped adapting to what the patient was asking them to do. What we did was introduce some plyometric work because that patient wanted to get back to doing some running. So all they've been relying on was calf raises, single leg calf raises, and that was kind of as hard as they made it. We started to do some plyometric work to get that stress through the tendon, to allow it to respond and adapt to back to a level where that patient could tolerate running again. Now, if you just rely on calf raises or doing simple exercises, you may see some benefit and then the progress may plateau, basically. And that's because the tendon just isn't responding and isn't adapting anymore. So that's something that's important to remember as well. And number 4 is poor return to activity. Now, what I mean by that is in the clinic, we'll use a battery of tests to stress test whether a tendon is ready for exercise. For example, if it's running, we'll do some single leg hopping, we'll do some jumping, we'll do some jogging on the spot, we'll do maybe 5 minutes on the treadmill, and various other things to test and to be sure that we're in the best possible place for the tendon to restart whatever it is that patient wants to do safely. We've done the work to prepare their tendon, and we're happy that it's going to be solid and safe and resilient enough to be able to tolerate what they want to be able to do. Often what I see people doing is think, great, I'm back, I'm going to go out and do my first 5K. And sometimes they get away with that first 5K. And it's the second one or the third one where it's bang and it comes back. That's a really important part to remember as well. 5th one is slightly less common, but hyperglycemia can be a reason why a tendon either gets better a lot slower or doesn't get better at all. Hyperglycemia is raised blood sugar levels. So that means someone who has a high sugar diet or maybe is inactive would not be burning off any excess sugar and maybe be consuming too much sugar as well. Or if they have diabetes in their body, you can use the insulin to break down the glucose. And what that means is the conditions for the tendon to do its job of remodeling, regrowing into a healthy tendon is much more difficult. Those conditions are not conducive and the tendon isn't as happy to do those things. So it takes longer for someone to get better. Sometimes it can be a reason why the problem can start in the first place. What we need is a kind of homeostasis, the kind of right amount of blood sugar in the body for the tendons to do their job of remodeling. Now, if you have any questions or the things you're not sure about, leave a question in the comments box. I'll do my best to answer. You can also book an online consultation with me as well. My name's Ed, and thanks for watching.